Hello and welcome to the Oklahoma Mission of Mercy Exposure Control Plan Training. Our mission is to provide free dental services to the underserved. It is also our mission to provide a safe and healthy environment for our volunteers as well as our patients. The purpose of this exposure control plan is to establish a system that will assure all volunteers who can reasonably anticipate contact with blood or other potentially infectious materials are protected from infectious agents. The plan is intended to reduce the risk of exposures of the volunteers while you are performing volunteer services to patients. Those who are potentially at risk are dentists, dental hygienists, dental assistants, sterilization assistants, EMTs, nurses, and physicians. To reduce the risk of exposures, engineering and work practice controls are in place. The most common mode of transmission of infectious diseases in a healthcare worker is a sharps injury. Safe needle practices that can help prevent sharps exposures are the one-handed scoop technique or use of a recapping device. Recapping used needles immediately following use and place all used carpules and needles in the sharps container provided in each area. Transportation of contaminated instruments to the sterilization. Once treatment has been completed on your patient, place the dirty instruments into the container provided and take to the dirty location in the central sterilization area. Personal protective equipment is provided by Oklahoma Mission of Mercy. When aerosols are being produced, an overgown is recommended. There will be disposable gowns provided and will be worn until they are visibly soiled or wet. These are to be worn only in the clinic area and are to be removed if you are leaving the clinic floor. Gloves, masks, and eyewear are recommended when performing any dental procedure. Remember, this is the height of the flu season, and simple precautions can help reduce the risk of exposures. There are other measures to help to reduce aerosols, therefore reducing the risk of exposures. They are the use of the high volume evacuation, or HVE, and a rubber dam when indicated. The most common mode of transmission of infectious diseases are the hands. Good hand hygiene practices in this environment can be challenging, but there are a few good tips to help with good practice. Use soap and water if your hands are visibly soiled at the beginning of each shift or if your hands come in contact with blood or other potentially infectious materials. Use hand sanitizer provided in between each gloving or when soap and water is not available. Oklahoma Mission of Mercy is asking all volunteers who will be providing patient care to provide a copy of their hepatitis B vaccination status and sign the hepatitis B vaccination status form. If you do not have a copy of your vaccine status or you've never received the hepatitis B vaccine, mark the appropriate line on the form and sign. If you have a sharps exposure during the OkMOM event, there is a protocol in place to manage this exposure. Immediately wash the site with soap and water. Flush mucous membranes with water or saline. Notify the lead in your area or the infection control lead. Inform the patient of the exposure. Procedures are in place for testing of the source patient and the volunteer. Following good infection control practice will reduce the risk of exposures to bloodborne pathogens. Oklahoma Mission of Mercy will be following the CDC standard precautions to reduce the risk of exposures from patients to patients, patients to volunteers, and volunteers to patients. The standard precautions are use of PPE when providing patient care, good hand hygiene practices, sterilize all critical items, handpieces, dental burrs, and instruments, sterilize or high-level disinfect all semi-critical items such as cheek retractors and mouth mirrors. Disinfection of the dental unit prior to patient care. Oklahoma Mission of Mercy will be using cavicide wipes or spray. Therefore, we will be using the spray wipe spray or wipe discard wipe techniques. Clean each clinical contact surface with a disinfectant provided by wiping either with a cleaner or the cavicide. Discard the towel or wipe, then wipe or spray with cavicide and leave wet for 3 minutes. Allow to air dry. Do not dry with a towel. Always clean any item that has been contaminated with blood or other potentially infectious material before you disinfect. Cleaning of the vacuum lines. Vacuum lines will need to be cleaned after any oral surgery procedure, most dental hygiene procedures, or procedures where a lot of blood is produced. The product we are using will be located in each area in a 3-gallon water container labeled Do Not Drink. Place a few ounces in a plastic cup and suction through the HVE or saliva ejector until gone.